The drug which we are going to study today is a remedy for the people who are always liars. It has been generalized as they are the chronic liars, who always deceive others, who always cheat others. It is not lycopodium, it is not cannabis. This is a remedy for the people who are always drowsy, people who are always semi-conscious. When you ask them anything, they say, I don't have any problems, I don't have any complaints. But for the people at home, he is a problematic. This is a remedy, is a substance from the narcotic substance. This is not cannabis. This is for the child who get epilepsy or spasms or convulsions, especially by the fright of a mother. It is not aconite, neither it is not a chamomilla. This is for the people for the first and second childhood. Here the second childhood means the adults or the old age people who behaves like a child. It is not lycopodium. The drug which we are going to study today is opium. Opium somniferae. As the name suggests, somniferae, something which induces sleep. It is a narcotic drug. Common name is poppy. It belongs to the family called Papaveraceae. We have many drugs from the family Papaveraceae like Chelidonium, Sanguinaria canadensis, Sanguinaria nitricans. It is a narcotic substance which has been obtained from the unripe seed pods of the opium poppy. You can see an image where all the petals are fallen off. Actually, it is a beautiful flowering plant. It is an ornamental plant. Variety of colors, different colors, flowers are seen. It has been obtained by slightly incising the seed capsules or slightly scratching the seed capsules of the poppy after the plant's flower petals have fallen. We need to wait till the petals of flowers have fallen down. Then you need to scratch or give a small incision. From the seed pods, when you give an incision, you get a milky latex. You can see here that milky drops, which then coagulates and changes its color when it gets exposure to the air, and it becomes a gum-like brown mass. This raw opium may be ground into a powder, may be sold as a lumps, sold as a cakes. It has been used for the medicinal purposes, and it has been used as a drug, and illegal uses are found. Like that, there are many uses. It has been used as a painkiller. It has been used as a sedative. It has been used as a narcotics. It has been used as a cough syrups. It has been made into a heroin. There are a variety of uses of opium. For our homeopathic purpose, mother tincture has been prepared from the exudations of the opium plant. It is a native of Turkey, Europe, India, Persia and China. It has been proved by Dr. Samuel Hahnemann in the year 1805. History of opium. There are lots of histories about opium is available, medical, non-medical, about the wars. Here I will concentrate mainly related to the medical field. 1st century CE, the Greek physician Dioscorides described about the opium in his book called De Metre Medica, which was the leading Western text on pharmacology for centuries. Why opium is called as opium? Opium, it derives its name opium from the Greek word called opion, which in fact derived from the word opos, which means juice of a plant or a plant juice or latex. As we all know, opium is a medicine prepared from immature seed pods. After the flower petals fallen down, after incision is given, a poppy tears will come, white substance which will turn into a thick brown substance, a latex later. Morphine is a name derived from the god called Morpheus, the god of sleep. as morphine will produce sedative action. It will produce a sleepy state because of an alkaloid present on the plant. It's called somniferum, which means to sleep, from the Latin word somnus means a sleep and fere means bringing. So this is opium is a plant which brings you sleepy. This is in short introduction about the history of opium and why opium is called as opium and why the morphine is called, why somniferum is called. In this slide you can see a fresh opium milk extract which comes after a incision, and at the same time you can see in the right side the same milk extract from the opium which has turned to a brown like a latex. So opium is also called as a poppy tears. It's like a cry of the poppy. A scientific name also, Lacrima papaverisi. Dried latex is obtained from the seed capsules of the opium poppy, Papaver somniferum. So this is how it is the various names: poppy tears, Lacrima papaveris, Papaver somniferum. All these are the self-explanatory. Opium plants are cultivated in a large scale in some of the places like India, Turkey, Afghanistan, for various reasons, for the medicinal purposes. There are a lot of medicines are prepared from the opium and also for the food substances. It is an illegal, but for the medical purpose we can use that. You can see an image where it has been cultivated in a large scale. You can see images of opium flowers. Such a beautiful flower. It comes with various colors. Some are red in color, some are pink in color, some are purple in color, some are white in color. It's an ornamental plant. It can be cultivated or it can be grown in a garden, but rules and regulations varies from country to country. It is illegal to grow, but it has been legal to grow for preparation of medicines. It has been grown in a large scales in India. It has been grown in large scale in Turkey and some of the Western countries for the various medicines, especially for cough syrups, so especially for painkillers, especially for sedatives. For that purpose, opium is being used legally. Illegally, it is being used for preparation of heroin and other narcotic drug substances. For homeopathic purpose, to prepare the opium medicine, the white flowered plant is being used. You can see in this image a yellow sticky substance. As we know, opium is been prepared from the immature seed pods. After the flower petals have fallen down, by giving an incision you get a white milky substance. When it get exposure to the air, and after some days it will turn brownish in color. Later on it has been removed and you get this substance. From that the medicine has been prepared. We'll see what are the alkaloids present in the opium. It has got many alkaloids. Approximately 12% of the opium is made used for the analgesic purpose because of an alkaloid called morphine, which is processed chemically to produce a drug substance called heroin, which has been illegal, is been used for the drug trade. Opium alkaloids are mainly two types, which has been depends on their chemical structure and their action. Morphine, which is a painkiller, codeine, which is being used for the cough syrups or antitussive, and the thebaine, which represent one type of action, especially it has got action on the central nervous system, and they are analgesic and they are narcotics and potentially addicting compounds. We have another variety of alkaloids called papaverine and noscapaine, which formerly called as narcotin. The most of the other opium alkaloids act as a relaxant, involuntary, smooth muscles. We said opium has been used for the medicinal purposes. It has been used illegally as a drug, as a narcotic substance. It has been also used as one of the food ingredients. You can see this poppy seeds is called as couscous, which is very commonly used for juice. It has been used for spreading over the bread or spreading over the cakes to make it more tastier. You can see in this image where you can see a couscous and a bun with poppy seeds are sprinkled over there. Opium, we know that it has got a great sedative properties. It is a narcotic drug substance, so it has got action on the mind, it has got action on the sensory organs, it has got action on the nerve or nervous systems, it has got special action on the lungs and GIT. Regarding the pathophysiological action, because of the alkaloids, morphine, codeine, thebaine, it exert their main effect on the brain and spinal cord. The principal action of this substance is to relieve or suppress the pain. The drugs also elevate the anxiety, induces a kind of relaxations, and it will produce a kind of drowsiness and finally a total sedation. And many impart a state of euphoria or other enhanced mood like alcohol, like cannabis or like ganja. Opiates also have important physiological effect. They slows respiration and they slows the heartbeat and they suppresses the cough reflexes and they relaxes the smooth muscles of the GIT. An acute overdose of opium causes respiratory depression, which can be fatal. Opium is a remedy mainly adapted to the children and old people, extremes of age groups. Many of the textbook it has been described opium is a remedy for the first and second childhood. First childhood we all know. Second childhood year represent, that means the adults or old aged individual who behave like a child. We might have seen many such individuals in and around us. Remedies like Baritacarb, remedies like millifolium, remedies like lycopodium. Opium is also adapted to the person with light hair, laxed muscles. You can see a image, a marasmatic pale child who looks like old man with wrinkled face. Many of the textbook it is described opium looks very old for their age, looks like a dried old man. We have remedies like lycopodium, we have remedies natromure, we have remedy iodum, who looks very old for their age. Opium is also adapted to the people who are chronic liars. They'll never tell the truth, like lycopodium. The face looks like a red puffed, eyes are glassy and half closed with pupil contracted. The face looks like a drunkard, like our remedy baptisia, gelsemium, stramonium, argentum nitricum. This is how a typical opium person looks like. It's also adapted to the people who get very often complaint from fright or fear. Thermally, opium is in a hot patient. They get very often, most of the complaints are aggravation hot. Very often they go in search of cold places. They cannot tolerate hot of the bed. Heat of the bed they cannot tolerate. They need always fan. Like our medorinum, like our lachesis. Miasmatically is predominantly a Hahnemannian antisoric remedy. It has got psychotic expressions. It is also has got syphilitic expression. We'll see some of the keynote indication of opium. The first and the most important indication of opium, want of susceptibility to the remedies. That means a lack of vital reaction. The well-chosen remedy makes no impression. You might have worked out the case in detail and gave the medicine for this patient, and patient showing no reaction. There is no improvement. There is no change. Or many of the nosodes have got these symptoms that well-chosen remedy fails to act. We have got many remedies like carbovage, sulfur, sorinum, loroceresus, which is a remedy given for cardiac and respiratory complaints, valeriana. So, there is no response to the medicine. The person remains silent and no response at all to the medicine. That gives an indication of opium. The second indication, with almost all the complaints associated with great stupor, person remains in a drowsy state, like our arnica, like our baptisia, iosymus, califos, phosphoric acid, stramonium, naxomica, gelsemium. Person remains in a state of stuporous, naxmoscata. There is a total painless. There is a complaints of nothing. He wants nothing. He thinks that he is not at home and picking the bedclothes during the sleep, with a state of great sleepiness with nearly almost all the complaints. That is a key indication of opium. Many of the textbook, this symptom has been described as a painless, complaints of nothing, he wants nothing. You ask him, what's your complaint? He says nothing. But others are observing that he has got a problem. But he says, I don't have any problem, complaints of nothing. He almost remains in stuporous conditions. For the painlessness, we have got remedies like stramonium. Stramonium also is great painless remedy, except hip joint is painful, especially the left hip side is painful in stramonium. Opium complains with insensibility, which is reverse of coffea, reverse of naxomica, reverse of belladonna, highly sensible, but in opium it's totally insensible. Partial or complete paralysis that originate from fright. Many of the complaints which comes as a result of fright or bad effect of fright, from the fear which still persisting. For the fright we have got many drugs, aconite, iosymus, which are more of acute, but in opium the fright part which is persisting, there is a bad effect of fright of chronic origin. In aconite and other remedies, a fright of acute duration or short duration, but opium is a prolonged effect of or a chronic effect of fright. It's also elements from charcoal vapors like acetic acid, element from inhaling gases, or elements of drunkards like naxomica, agaricus. Next indication of opium is indicated for spasms or convulsions of children whenever a stranger is approaching them, or a nursing mother whenever she gets frightened and the child gets epilepsy, or whenever the mother gets anger like chamomilla, whenever there is a suppressed eruptions, whenever child gets crying, child will getting convulsions, where the eyes remained half open and it is upturned without consciousness. For the convulsions we have got many drugs, with consciousness and without consciousness. Belladonna, cicuta, iosymus, all these remedies are without consciousness, whereas naxomica is with consciousness. Associated with spasm, this skin is covered with hot sweat, especially after convulsions. So child get epilepsy or child get a spasm whenever some strangers are approaching them, whenever the mother gets frightened, especially the feeding mother, or maybe whenever the mother get angry, or whenever there's a suppressed eruptions, all this thing leading to a convulsion without consciousness. The fifth indication of opium, the bed feels so hot she cannot lie on it. We have remedies where the bed feels hard. Person will be moving in search of the soft places like arnica, bryonia, pyrogen. Person moves often in search of a cool places and must be uncovered. He cannot tolerate heat at all. That is a characteristic indication of opium, like medorinum, like sulfur, like fluoric acid, like iodine. Another indication of opium comes in relation to the constipation, especially of children, or constipation of old people, of corpulent or good-natured women like graphitis. It is like a total inactivity of the rectum, as though rectum has been paralyzed or the intestine has been paralyzed. There is no desire for evacuation. Constipation is also from lead poisoning. The characteristic of the stool is very hard. It's a round black balls, like a sheep dung type of stool, which is seen in Chilidonium, Plumbum, Thuja. Feces protrudes and recedes backwards, like Silesia and Thuja, that kind of stool. Stool is very hard, black, especially in children with the total inactivity of the rectum. Stool comes till the verge of the anus and recedes backwards, like our Silesia, like our magnesium mure. This is the indication of opium in relation to the constipation. Opium is also indicated for involuntary stool, especially after a fright, like our gelsemium. The stool is very black, highly offensive from the paralysis of sphincter. Opium is also indicated where the peristaltic movement is reverse, that means omitting of fecal matter or fecal omitting, like our arsenic alb, colchicum, plumbum metallicum, cuprum, thuja, sulfur. Peristaltic movement is reversed or paralyzed. You get in clinical conditions like intussusceptions or intestinal obstructions. Bowel seems to be closed and leading to a hernia. The ninth keynote indication of opium, person is very sleepy but cannot go to sleep. It is mainly because the striking of a clock or crowing of a cocks at a great distance keep her awake. This is the thing. Person is thus hearing is so sensitive, from the distant noises keep him whole night awake. Another indication of opium, complete loss of consciousness with slow and deep stertorous respiration, like our arnica. Person remain in a comatose stage, maybe a kind of stroke, maybe of any reason, maybe because of paralyzed, where both inhalation and exhalation are difficult. Person loses a breath on falling asleep, like ammonium carb, grainelia, lacaninum and lachesis. Opium is also indicated for retention of urine with the full bladder. Retention may be after postpartum periods. Retention may be after excessive use of tobacco. Retention may be in child or infant after a frightened mother. Retention may be after a fright in general. Retention may be after an acute episode of fever. Retention may be because of paralysis of the bladder or sphincter where the catheter has to be used. Opium can prevent that episode of catheterization. Opium is also indicated for apoplexy of drunkards from the fright with stertorous breathing, jaw is dropped down, pupil is dilated and contracted, there is a hot sweat on one side, paralysis. That is the indication of apoplexy of opium. Regarding the delirium of opium, constantly talking with eyes wide opened, puffed face, eyes half closed, and person is in unconscious or semi-conscious, and finally will go to a stuporous and coma sets in. That is the indication of opium in delirium state. Opium is indicated for the person who has got increased sexual desires, like our cantharis, naxomica, platina, sulfur, phosphorus. They have erection especially during sleep, like asteria rubens, fluoric acid, naxomica, rhododendron, and with impotency when the person awake. This is a characteristic indication of opium. It's also indicated for the bad effect of lead poisoning. This remedy has been used for the complaints after lead poisoning, like our alumina, colocynth, naxomica, sepia, veratrum album. This is all, in short, keynote indication of opium. We'll see some of the great stalwarts, what they said about opium. Dr. Samuel Hahnemann says that it is much more difficult to estimate the action of opium than almost any other drug. He has given the detailed explanation why the primary action and secondary action is very difficult to assess about the opium. Dr. Herring says, opium renders the intestine so sluggish that the most active purgatives lose their power. This is what Dr. C. Herring said about opium. Dr. Lippe, he said, persistent diarrhea in those treated with large doses of drug, opium is indicated. We'll see what are the etiological factors for opium personality to fall sick or indication of opium. Element from fear, like our aconite, Alzheimer's. Element from fright. Regarding the fright, I already said opium comes most of the time for the chronic effect of fright, not an acute effect of fright, mostly a chronic effect. Element from anger, element from shame, like our staphysagria. Element from sudden joy, like our coffea cruda. Element from sunlight exposures, element from alcohol, especially of drunkards. Element from charcoal fumes, like pyrogen. Element from inhaling gases, elements also from opium poisoning, element from lead poisonings, elements from suppressed eruptions, like many of the antipsoric remedies, elements from tobacco, like our arsenic alb, naxomica, ignatia, staphysagria, element from strangers, like our Beraita carb. These are the main etiological factor of opium. Regarding the general modality, aggravation by heat, aggravation by hot bath, aggravation during and after sleep, aggravation also from stimulants, and aggravation by fright and joy. Regarding the amelioration of opium, most of the complaints are amelioration by cold, amelioration by constant walking, and also amelioration by open air. We'll try to understand opium at various levels of personality. We'll see how the opium person has evolved over a period of time. We'll see as a fetal state, we'll see at neonatal state of opium, at the childhood days of opium, adolescence periods of opium personality, adult life of opium personality, and at the old stage. We'll try to understand the opium personality in all these stages. At fetal stage of opium, specially indicated whenever mother had experienced a state of fright during her gestational period. Mother and child are one unit. Whatever mother is undergoing, definitely it will have impact on the baby. It may affect baby's milestones, it may affect baby's personality, all because of mental state of mother. A strong bad effect of fright to a mother will definitely have an effect on the baby. Or whenever the pregnant woman is been addicted to some opiates or some heroin or morphine, such mothers, babies born, could be a opium indication. Or a mother had taken a strong sedatives or any painkillers during her pregnancy period. Or mother suffered from constipation during gestational period. Or mother had violent fetal movements during her pregnancy periods. Or the process of labor is very difficult. A mother had a shock at the time of delivery and she has been given injection, or she has been given some injection, she went to a state of coma, or she went to a state of shock and the child is born after that. All these fetal periods, opium personalities indicated. Opium at neonatal periods. The most commonly indication of opium at neonatal period is mainly a asphyxia neonatum with consequent effect at the mind and the body levels. Child getting a asphyxia neonatum and leading to poor development of the mind and poor development of the body. Child may become unconscious with pinpointed pupils. As a result of asphyxia neonatum, child may end up getting convulsions with cold perspiration. Child may be having a retention of urine soon after the birth. Child may be having constipated bowels with no urging for days together. Child might be having a birth trauma like caput medusae and leading to various complications of development at the neonatal periods where opium is indicated. Opium as a child, maybe because of fear or fright of mother, maybe because of trauma to a mother, maybe because of asphyxia neonatum, maybe because of fear into a child, leading to milestones are delayed. Child may be mentally retarded. Child may look imbecile like our Baraita cub. Child may look mentally retarded like our Medorinum. Child is emaciated look, not putting on weight at all. Child looks very marasmus like Iadum, like Natromure, like Ethusa, like Hebrotanum. Child has failure to thrive. Nursing mother is in a state of fright and child gets convulsions. So whenever the child sees some strangers and child will have a problem. There are lots of behavioral changes you see in opium child. Opium child is a constant telling lies to the teacher, telling lies to the friends, to telling lies to the parents. It's a chronic liar. You need to compare lycopodium child also. Here the child will have a total indifferent to immediate surroundings. Child doesn't do anything. Child may not do homeworks. Child appears apathetic. Complains nothing, doing nothing. You ask anything, child doesn't do anything. Child, maybe because of mental retarded, maybe because of imbecile, child will have a total confusion at the mental level. If child has been asked to perform 2 tasks, he'll end up in getting into a confusion state. That is a typical of opium child. There is a lack of maturity in a child, resulting in impulsiveness and doing reckless behaviors. Child will be most of the time remains in a dreamy state, a semi-conscious state. Child doesn't understand any ground reality. Child may be having an absent-mindedness. He appears cheerful. He appears to be innocent. Maybe because of over-pampered by the parents. As you know, child has a tendency to tell lies. Child will do many things, stealing things, kleptomaniacal behaviors, like our tarantula. Child will have deceptive behaviors. Child at times will have a temper tantrum. This is how you can understand opium as a child. Opium at the adolescence period. Opium's behavior during the adolescence period is totally disproportionate to his physical age. His behaviors are too childish. He'll be untruthful. He'll be unsympathetic. He's totally immature in his perceiving. He's immature in his thinking pattern. He'll have amorous behaviors. He'll have shameless behaviors. He'll have perverted sexual behaviors. His comprehension is very low. He'll be mentally dull. His academic performance are day by day going lower and lower. He get affected by slightest insult, like our staphysagria, he cannot bear insult. He get affected by slightest indignation. He get affected by mortifications, like our bryonia, staphysagria, lycopodium. He get affected by fright. At times, he expects too much of love, and when it is offered, he behaves indifferently. The same kleptomanic behavior continues. The same deceptive behavior continues at the adolescence period also. And most of the times, his response to the pain is totally painlessness. Even after a biggest injuries, even after a trauma, he will not have a pain. That is a typical adolescence behavior of opium. Opium during the adulthood. As other stages of life will persist, some states will remain, like a chronic liar which will be persisting throughout. He knows well how to deceive others. Apparently, he gives a feeling of innocence and he gives a feeling of he is a dull, and he uses this weapon to progress in his life. He will win by deceptions, he will win by cheating. Opium retains the timidity even in the adulthood. He doesn't want to take any risk in the life. He doesn't want to take any task in the life. He's not like lycopodium. He's not like Naxomic who will go forward and take the leadership. Most of the time he remains at timidity. Most of the time, opium, a dependency state is marked. He can't discharge a responsible work. He has the less capacity to work hard. So instead, he'll sit alone. He sits at home. He'll not go for a job. Does nothing but he'll become a burden for everyone. He'll be a burden for the family members. You might have seen some individuals are like that. They'll not go for a job. They'll not go for any works. They'll sit idle at home, eat and sleep, and most of the time they'll be sleepy. That is a typical opium state. He wants nothing. With a complete loss of consciousness. And sometimes, as a pathology is advanced, he may be in an apoplectic state. maybe picking the bedclothes. Maybe he is getting a frightful dreams. He may get a dreams of mice. He may get a dreams of scorpions. This is the typical adult of opium character. Most of the time, opium personality gets a complaint, even at the mental level, mainly because of a fear, or maybe because of a fright, or maybe because of long-standing exposure to alcohols. It may be because of some kind of shame they felt in their life situations. Maybe some kind of insult. Incidents like fear, fright, shame, insults very often make them totally withdraw from the society, totally make them alone. You need to compare aconite, you need to compare staphysagria, you need to compare bryonia, you need to compare lycopodium. Each drugs, whenever they get exposure to fear, fright, shame, their responses are totally different. Bryonia may get headache, bryonia person may get anger. Lycopodium patient also may get anger. But here, opium person will try to withdraw from all this situation and he'll try to become alone. Opium not only suffer from physical constipation, but it has been described that they are mentally constipated as well. Means here the constipation mentally level means they get stuck. Mentally they get harder in their thoughts. Maybe as a result of fear, fright, shame, do not get processed. They stuck there only. They'll remain in their mind as if they have some heavy weight at the mental level. Mentally they are as if they are been paralyzed because of all these incidents happen in their life. Mentally they become dull, they become totally confused. They are unable to take up any responsibilities. And totally, as the days advance, they'll remain in a semi-conscious or unconscious states where they don't have any complaints, they don't have any things, they don't have any desires. That is a typical opium personality. We'll see some of the fear factors or fright factors of opium. We know that the opium personality, mentally they get stuck with some of the incidents they faced in their life. Maybe a fright, maybe a shame, maybe a fear, maybe an insult. The fear factors are persisting in them throughout because it got stuck. Opium fear generally revolves around their excretions. It affects in the physical level also. As many of their complaints caused or aggravated when it comes the process of expelling something from the body. If you see many of the rubrics, the mind fear chapter, diarrhea fear with, diarrhea fear from, fear urine, retention of urine from the fear, fear menses during, fear labor during. All these rubrics, opium is the leading remedy. Even the complaints are related to the physical levels, maybe of diarrhea, maybe of urinal complaints, maybe of menses, maybe of labor, but it has been attributed to the effect of fear. Opium during the old age. We know that opium is a remedy indicated for first childhood and second childhood. Here the second childhood means a old man who behaves like a child. The senile period of opium is mainly characterized by more of depressive phase at the various levels. The mind loses its go. The mind loses its speed. Very often patients suffer from many of the psychiatric illnesses, like he may go for depression. he may become imbecile. He may have schizophrenic state of mind. At the physical level, he may have chronic respiratory diseases. He may have paralysis of the single organs, or he may have cerebrovascular strokes. The end of opium is usually unconscious states where he demands nothing. He'll totally remain unconscious, insensible. He'll be calm and a flaccid stage. This is the opium at the old age. He may have chronic constipation at the physical level, and mentally he is totally unconscious. He may become semi-conscious. He may become drowsy most of the time. This is the typical old age feature of opium.